Very few things boggle my mind as much as how poorly we treat people with addiction, like patients with opiate use disorder. And for some of them, things like buprenorphine or Suboxone can be great for their recovery. But oftentimes it's not enough to stave withdrawals, and then they need things like methadone. And if you don't know, if you're on methadone, you need to go every single day to get your single day's worth of methadone. And even that isn't 100% successful. Some people need to be on methadone twice a day, different doses twice a day, so they don't go through withdrawal in the evening. But that's incredibly difficult for them to live a quote-unquote normal life. How are you supposed to go to jobs with certain hours? How are you supposed to drop off your kids at school? Because, by the way, people with opiate use disorder have families. And even if you are in a state where you can have prescriptions of methadone to take home with you, you need to be 100% compliant, 100% clean, 100% on time with your daily methadone clinic appointments to get your doses, which even people without opiate use disorder, that's incredibly difficult. Sometimes traffic is harder. Sometimes you wake up late, and then you lose months of progress, even if you're still in recovery during that process. And I like to think of it this way. Imagine if you're a patient with diabetes, which, is a disease. And let's imagine you had to go to a clinic every single day to get your insulin. Or let's say in the hospital, because people who are on methadone are chronically underdosed, and there's a lot of red tape to give them the amount of methadone that they need. It's not uncommon for someone to be on 200 milligrams of methadone a day to keep from going through withdrawal. And by the way, as a reminder, people don't take methadone to get high. People take methadone to feel normal and not go through withdrawal. But let's say that same stigma works in the hospital for people with diabetes. They say, oh, well, you're on 20 units a day. It's our policy to actually give people 3 units a day. And if you go into DKA, that's actually a moral failing on your part for being diabetic. That's just a ridiculous thing, but it happens all the time for people with opiate use disorder, and it makes no sense. People just say, oh, it's an opiate, they might abuse it, and then it makes their entire recovery process incredibly difficult. The more I learn about this, the more frustrated I get.